All right, welcome everybody. We'll give everybody another minute or so to get in and we'll sort of get rolling. Okay, so welcome everyone. We've got a very special webinar and very special guest today. We'll be talking about, I think, a super interesting topic and really the use of digital tools to assess and treat rock climbers and their injuries. With us today, we have Dr. Jared Vagey, who Dr. Vagey is a doctor of physical therapy who specializes in treating rock climbing injuries. He's the author of Amazon's #1 best-selling Climb Injury Free and has published numerous articles on injury prevention and lectures internationally. Dr. Vagey is one of the teaching faculty at the University of Southern California, which is one of the top physical therapy programs in the U.S. So first off, there'll be a quick poll on your side just to see where everybody's sort of from, U.S., Europe, Asia, and so on. If you guys can sort of click on it and see where our folks are from. Looks like most everyone is here in North, South America. Cool. All right, Jared, take it away.
All right. Well, thank you for the introduction. I'm excited to go through what I know about using digital tools with rock climbers, and I use them heavily in my practice. And so I'm going to share some tips, tricks, and kind of clinical pearls on that realm. Overall, the goal of this is really to understand the big difference between manual muscle testing and using dynamometry, understand the strengths and weaknesses of different ways of manual muscle testing climbers, and how to use these digital tools to benefit your assessment. And as far as disclosures, as was mentioned, I'm the author of the book Climb Injury Free and the developer of the continuing education course series of Rock Rehab. And as far as non-financial disclosures, I'm a speaker for TheraBand Academy, and I was provided products from Kinvent to demo and provide feedback. So I don't have to go into my professional background because that was part of the introduction, but I want to tell just a little bit about how I got into working with and treating rock climbers. Now, I got into this actually through injuries myself. I was climbing as much as I could, and I remember I was hanging from the molding in the door frame. This was way back, almost 18, 20 years ago. I was hanging from the molding of my door frame like 6 days straight to strengthen my fingers. I was working out and climbing almost every day, and I went to Joshua Tree, which is a world famous climbing location, and I got on a route. I worked my way up the route. I was exhausted. I got what's actually called Elvis legs, where your leg just starts shaking, and I almost couldn't finish the route, but there's this last move I pulled through, and at that last second as I pulled, I actually sprained a ligament in my finger and I tore my rotator cuff. And so that was actually when I was getting my doctorate in physical therapy, and I should have known better. And from there, I started actually, first figuring out how to treat and rehab myself. And then I started writing articles. That was back when magazines were popular. And so I had a column in a magazine. I started going to climbing festivals and seeing climbers there. I started treating climbers in the clinic, and eventually built that into writing a few books on the subject. And I published peer-reviewed articles, and really working with anywhere from novice climbers to the top professional climbers in the world. It's a really big part of my personal identity. I actually climbed this morning and climb almost every week, and I'm really passionate about teaching clinicians how to assess and treat climbers from some of the experience that I've gained over the years. So I'm just going to start with a very brief introduction to the disciplines of climbing, and then we're going to dive quickly into how to assess climbers. So there are three main types of climbing. There's route climbing, which you're ascending, greater than 15-foot routes. You're clipping into quick draws, which are either attached to bolts that are already in the wall, or you're placing your own gear of protection. There's bouldering, which is about 7 to 15 feet. If you fall, you fall on a padded surface known as a crash pad or pads in the gym. And then there's speed climbing. And speed climbing is you're racing a competitor up the wall as fast as each of you can go, and you hit a timer at the top and see who has the quickest time. And it's a set route, standardized route of 49 feet. So those are the different disciplines. There's a couple other disciplines in climbing, but these are kind of the main disciplines that are used or utilized, and especially at the international and competitive level. And then climbing can really be either indoors on artificial terrain, or it can be outdoors on natural climbing terrain. So I just wanted to briefly just touch base on what climbing is, the different components or disciplines, and as well the settings.
So sort of bring us to our first poll is just what folks think in general, whether it's easier to get injured more in a gym or outdoors. Anybody have an opinion? Has either treated climbers or has climbed? Feel free to chime in. So I'm sorry, the poll exactly is it's easier to get injured outdoors than climbing in a gym. Cool. So sounds like we're, oh, never mind. I was going to say more agree and disagree, but it sounds like we're sort of more neutral, trending towards disagree. So it's easier, it sounds like, to, now people just don't know, it's just neutral. Yeah, so it seems like we're trending towards more, it's easier to get injured climbing out in the gym than outdoors.
Yeah, and that's oftentimes the case, because in the gym, you have a very high density of routes that are next to each other. And you can just keep climbing route after route. And, there's also some very challenging routes, but the amount of volume that you can cover and in one time is sometimes much more than you can do outdoors, where sometimes you go to a cliff and maybe there's only one or two routes that you can climb on that cliff. Or if you're bouldering, you have to, hike 20 minutes to get to the next boulder problem. And so we tend to see there's some injury statistics that are coming out, but we're tending to see more and more injuries are occurring pulling on plastic, which is your artificial or indoor climbing. Now, so those are the different settings. I want to get into really what the heart of this presentation is how do we utilize digital tools, and how do we also utilize manual tools or our own hands to assess rock climbers. And first, let's talk about manual muscle testing versus dynamometry. Now, think about a climber. You're grasping onto different shaped holds. Some are large here, like you see, it's called a sloper. Some are very small, like that purple hold on the left-hand side of the hand, which is called a crimp. But you're utilizing a lot of finger strength and at the same time wrist strength. And so I want to get in depth first in how we assess the strength of the muscles of a climber that pronate and supinate. I'll then get into flex and extend the wrist, and then we'll get into the fingers. So first, our manual muscle test. This is classic. This is textbook. So if you wanted to test pronation, you could see here, you put the muscle in a shortened position, palm down, end range pronation. You grasp on the distal aspect of the radius and ulna, and you pull the climber into supination, thus testing the pronators in a manual way. If you were to test supination, it'd be the same thing. Put them in end range supination. You'll stabilize their elbow. You'll come in and you'll try to pronate them to get that supination muscle test. Now, you could see when I do this that I'm stabilizing at the elbow, and I'm also in a moment going to grasp the distal radius and ulna. I don't grab the hand, because finger flexion and extension and wrist deviation may actually influence that test itself. And so the question is, are these tests actually giving us true values of the strength of the muscles? And this was a study by Nagatomi and colleagues, and they looked at 53 participants that had unilateral shoulder pain, and they performed 3 different strength assessments. They really took a look at using manual resistance grading, so just a typical manual muscle test, and they compared that to handheld dynamometry. And here's what was really interesting, and there's multiple studies that show this. They found that muscle weakness in the injured shoulder compared to the opposite, the uninvolved side, could not be detected with patients of up to 60 to 99% strength of one shoulder. So basically what this shows is someone can have a 60% strength deficit on one side, and you can't detect that with a manual muscle test. And especially, I'm going to go back one slide, when we're dealing with, are my finger flexors and pronators stronger than this patient's, is really what we're testing. And the harder and harder of a climber you work with, you're going to find that it is almost impossible. When I'm working with elite climbers or professional climbers, there's no way that I can break them with a classic manual muscle test. And so I'm grading them a 5 out of 5 if I do this test, and that information is useless. It doesn't give me the true strength of the muscle. Maybe it tests apparent weakness, but not strength. So what was the research showing on handheld dynamometry? And there's plenty of these studies, but this was a large study by Bohannon and colleagues. They took a look at over 200 participants, and they found that by utilizing dynamometry, that it is a reliable assessment of muscle strength. And again, there's plenty of research to show when used correctly, and I'll show you how to use it correctly, that it's extremely valid and reliable. So how would you test the pronators and supinators of a rock climber? This is where it gets a little tricky. So if we're going to test the pronators, what I actually do is this setup that you see here. Now I have them rest their arm on a table. I'll have them grip something with their hand in a standardized grip, so it's always in the same position. I'll have them with that dowel. I'll mark a certain mark. I usually go 12 inches up, and I'll place a lashing strap around the mark and connect it to something stable next to them. And in this position, they can then generate their pronation force, and I can get a true value. So let's see what that looks like.
So just real quick, Jared, anybody still feel like manual muscle testing is efficient and accurate compared to using a digital dynamometer, handheld or stabilized, I guess? Yeah, so it sounds like most people would agree that it's dynamometry is clearly, they would disagree with the statement that manual muscle testing is as efficient and accurate, so they agree with the dynamometry. Go ahead.
Yeah, and I think on that end, like if we look at this setup, it's extremely accurate, except you have to make absolute sure, just as you do with manual muscle testing, that everything is set up appropriately. For example, if I didn't have a mark on this dowel and I had that 4 inches higher on the other side, increasing the lever arm, I'm going to get a completely different value. So the machinery, the dynamometry, the mechanics are fully valid, but how we test it has to be standardized to the T. The exact grip position, the exact handheld position, all that is so important. And it brings up another thing is we understand that it's valid, but I get all the time, oh my God, it takes so much longer to set up dynamometry than it does manual muscle testing. How do I do that with patients? So for myself, I'll tell you, I don't dynamometer every single muscle. I manual muscle test first. I get an idea, a hypothesis, and then typically in a session, I'll choose 1 to 2 muscles to get values on or focus on. So there definitely are some barriers to use, but the validity, as long as you set it up appropriately, it's highly effective and valid. And you can see here, we're getting a force reading pronating into the dynamometer. Now I'll typically do 3 trials and 5-second MVIC hold, so a maximal hold. This is how it ends up looking. You may be able to hear the audio, I hope. I'll hit the audio. And you could see with pushing into that position and the rest breaks, you can then get those values. And you can see pushing here again. And this is what I find is truly helpful with the digital tools. I'm going to talk about that. There's other ones, but you can see here you have max strength, you have deficits, you have comparing, contrasting the two, and these can kind of easily be kind of recorded as a value. And so you can see here that this value is something that's quite helpful. You can screenshot, you can export, but I find that this visual representation, especially using, for example, here, this kind of newer generation or the K-pole, I just find this so easy to kind of use and utilize, and it does make the implementation component a little bit quicker. So that's an example of pronation. Supination, the exact opposite, right? You have them on the other side. I typically have these lashing straps pre-rigged. What is a lashing strap? It's what you usually would use to like lash down your kayak or your surfboard or something like that. They're just a couple dollars. You can find them anywhere, but they're like one of the most versatile tools that I've found for dynamometry. I used to use chains because you could choose the chain rung, and there's less almost like tensile give, but lashing straps are just so much easier, and so I've kind of shied away from chains as of late, and plus they're a little too heavy to keep operating.
You use them, Jared, you use them for lower extremity as well, or would you just upper for lashing straps?
Yeah, lashing straps, it depends. So the current one that you see, you have to look at the rating. So that one's rated for 200 pounds. And so there's no way that with your supinators, you're going to pull 200 pounds. So that's completely fine. But obviously for the lower extremity, you're going to have to use thicker and thicker, more highly rated lashing straps. And if you get to the point where you're manual muscle testing, for example, the quadriceps or some muscle that just has a huge amount of force generation potential, that's sometimes when I'll get out the chains. And if I have a larger athlete and I need a little bit more confidence in the fixation, I'll use that. But typically I've been pretty good with like a 2-inch lashing strap, even for the lower extremity, especially when testing, for example, gluteus medius. It doesn't have as much force potential as the quadriceps. So this is testing supination, the same exact setup. You can see the pull here. I'll show the video, and you're just pushing down. Now, what I typically do, I'm absolutely try to make sure that all the variables are taken into account. And anytime that you have a perpendicular lashing strap, as you can see here, in a device, there is going to be a little bit of sagging. And what I do, I didn't do this because I'm capturing a video, but what I do clinically is I literally stand in front of the patient and I put my hand right under the dynamometer and I make sure that everything is lifted. So these are completely parallel to the ground. And then I know that I'm having an accurate pull and an accurate measurement. So this was a study by Gordon and colleagues, and it's kind of a fun study. They custom built this device to compare relative EMG of the forearm muscles during resisted forearm rotation. And they checked a lot of different torques of different muscles and positions, and in different positions. And the thing I found most interesting is they looked at pronation and supination torque. And in the neutral position, there was no significant difference between the two. And so this was a study that helps us kind of figure out that these ratios should be normalized, or they should be close to that 1-to-1. Now with climbers, it's a little bit different. If you think about climbing, you're constantly rotating your palm into the rock holds. And so climbers will typically have a little bit stronger pronator than supinator. So something that's good to kind of keep in mind. So moving on from pronation and supination, manual muscle testing, and dynamometry, now looking at testing the strength of the wrist flexors and extensors. So this should all look familiar. A climber comes in, or any athlete comes in, and you're testing the strength of extensor carpi radialis longus, brevis, carpi ulnaris, radialis, and even the flexors, going into test the extensors and the flexors and differentiating the strength of each of those. But again, what we're doing, and especially with climbers, is I'm testing my finger flexors, for example, in extensor carpi radialis longus, against their wrist extensors. And even if I am doing a full weight shift, it's sometimes really hard to break elite climbers or high level climbers or even novice climbers. The same with wrist flexors as well. So it's very hard to get accurate information. So the same question comes up is, how do you perform the same type of assessment, but with dynamometry for rock climbers? And how do we make it a little bit more climbing specific? Well, here's a method that I typically use, and I have the climber grab a portable fingerboard, which I'll explain in a moment. I'll place a pressure-based dynamometer on top of their wrist, and then I'll stabilize a lashing strap on top, put my foot to the ground, and have them extend their wrist back. If I really wanted to be perfect with this, I would strap their wrist to the table so that I had another level of isolation or stabilization. But where I find this so effective, and if you can maybe see me right now, is when you grab or when you grip. This is a portable fingerboard, and there's tons of different options of these that you can get. Is now we're turning on our finger flexors, grasping the same exact way in the same type of hold that you would when you're rock climbing. And now that the finger flexors are engaged, and what actually happens is our finger extensors and our wrist extensors co-contract when our finger flexors engage. But when those are engaged, we can then assess wrist extensor strength, making this a more climbing specific assessment. So an example as well, in this position, you can test the flexors. And so you can test the forearm extensors, and then you could flip everything around and you could test the flexors as well. So those are just a few different ways that I utilize dynamometry to get data for forearm muscle testing and results that I typically wouldn't have good enough data testing manually. So now let's look at the different forms of digital muscle testing. And there are several barriers to dynamometry. I'm a huge fan of dynamometry. I've been using it for years, and my progress through utilizing dynamometers has started with doing stuff that's been completely makeshift because I love numbers, to doing things that maybe cost a few more dollars, and then now I'm utilizing scientific tools because it gives me the best data. But anyone watching, whether anywhere in the spectrum of dynamometry you fit, I really want to encourage you to at least try it and use it. So I started out using a luggage scale, and this was many years ago. There was no true dynamometers out, except maybe one or two brands that were extremely expensive, and obviously iPads and iPhones weren't around, or they weren't popularized. And so I would travel a lot, and so I'd use my luggage scale. I think they're like $5 or $6, maybe $10. And I would use that. I'd have an athlete grab onto that and rotate their wrist back and forth, and I would get a value. Now, the positive about those is they're really cheap. They're really inexpensive. The negative is they don't hold a value. And so I would have to look at the number or video the number and see what the highest number was. And they can sometimes be accuracy, sometimes be slightly off, but they were good enough. I then upgraded to rigging a handheld dynamometer, which I'll show you in a moment, because there was just around the clinic. I just found one, grabbed it, and turning it into a muscle tester by using a bunch of straps in different positions. I then started using crane scales. Those are relatively inexpensive, maybe $50, and they hold a value, which is really nice. It's really heavy, and they don't integrate with an app. And then obviously I started using more advanced dynamometers. But this is kind of where I started. And you can see this is like a $25 gripping a handheld dynamometer. And I would just take all these straps. I rock climb, so I like different knots and different holds. And I would take these straps and I'd pre-rig a table at the clinic. And the key, one thing with dynamometry, if you're doing anything, is always pre-rig a table or a setup so it goes much quicker. Because you can see it just takes time to do all this. But I would tie that around. I would put these straps on this dynamometer. I'd fix that all together, and then I would have this like dynamometer where this would, for example, for a glute med muscle test, where I can just put this final strap on, and they could put their foot through that, and I can get an actual number because they're pulling the trigger there. So just know you can be makeshift with these things, but having numbers, having values is quite important. So we talked a little bit about
just one sec, Jared. So I just want to see if folks agree, having heard that, if digital dynamometry is a valuable tool for rock climbers, to see if we have any opinions. And it looks like most people are in agreement at this point. Rock on.
Yeah, I mean, I think it's such a valuable tool, and it's then utilizing it when it matters. And obviously there's always barriers to implementing. And so when it really matters is the fingers. And that's like, if you're a climber and you're imagining you're on the side of a cliff, and what you hold on to the rock is actually your fingertips and your toes. So being able to load the fingers, being able to understand how to properly assess and test the fingers, I find that I use dynamometry with almost every single patient that has finger pain that comes in the door that's a climber. Now, how do I set this up? How do I rig it? Well, this is my setup. And, I have this freestanding board that I hang a bunch of stuff from. I'm a climber, right? So I have all different things like hanging from there, different carabiners, different pulleys to unload. And as we scroll down here, you'll see I have a lashing strap, so I can self-adjust. And then I have this hanging block. And you can have any type of block, but there's these different in cuts. So 20 millimeters, 25 fingers. You can get in different crimp or grip positions. And so I have that just hanging there. And if I truly want to test the fingers in isolation, I then have this table that just conveniently slides in right between the stand. And that is my setup. So I have hanging this dynamometer right here, the lashing strap, the finger gripping block, and then a stabilization table. And if you have that, then I connect it to a TV through AirPlay. And I spin the TV around when they're doing the test, but then I obviously spin it towards them to show them. And so that's kind of like the full-on setup of what things look like clinic-wise. And so how does that work? Like how do we test with that? Well, you can see here, I have them put their elbow on the table. I fixate that position so their elbow's under their fingers. Have them come up nice and tall. You can have any device, on top to measure the force pull. And then they're just flexing only with their fingers. They're pulling down with their fingers and generating that kind of maximal force. And then you can obviously take a look at the measurement there. So that would be tension-based dynamometry. And this is what's called fixated or fixed dynamometry. Non-fixated or non-fixed dynamometry would be the elbow is free. Maybe they're standing and they're pulling down, but they can use their lats and a little bit more of their biceps as well. But this would be an example of tension-based. I use compression-based dynamometry. You just set up, for example, I have here, this is one of the V3s or version 3s of the device, but you just place this on a firm, stable surface. You put that portable fingerboard on the surface as well. And all you do is you have the climber come up to it, and they can stabilize their elbow just like so on the table, or you can have their elbow kind of freestanding. And they just pull down, and you can get a dynamometry measurement with that. So it's really helpful to be able to have versatility to either test tension-based or compression-based dynamometry. And the fingers are, in my opinion, one of the most important parts of the body of a climber. to test
So
with
I
dynamometry.
think that basically answers the next poll question. Was finger strength the most important attribute to elite rock climbing? Which I
But
wouldn't have.
I may be biasing people. So
Yes, just a little slightly, yeah. Yeah, and I think one of the things initially for myself, certainly, if you're not treating a ton of rock climbers, right, you think of finger grip as just taking a pinch dynamometer and just assessing grip strength pad, like pinch strength pad versus tip and so on, and not going into different holes, which is such a big deal in this population.
yeah, I mean, I used to, and they've had a couple studies on this, but I used to run tests myself, and just for fun, I've worked with some of the strongest climbers in the world, and I'd have them do a handheld dynamometer, and then I'd have them do isolated finger strength testing, and in climbing positions, and there is no correlation between global grip strength and climbing
Right.
ability, but finger strength is so important in climbing specific positions. And yeah,
Do,
as you mentioned, testing that
do
is
you think
key.
if you take a non-op rock climber and you're trying to tease out specifically what may be ailing them, right, when they have pain, even if you know what grip they're using, right, being able to isolate individual muscles and individual values that are more objective, has that sort of changed things for you, right? Because you've always had some kind of device, some kind of fingerboard, but being able to get that digital data quickly, has that changed things
Oh
significantly?
my, it's for me, it's been a game changer. One is what you mentioned is quickly, because I still use crane scales and different dynamometer tools, and I have an assortment of kind of different tools in the arsenal. But for speed, accuracy, and patient education, a digital dynamometer that connects to an iPad and actually connect that to a TV screen is a game changer for patients because they pull into it on both sides and then they can see a graph of like, oh no, this makes sense. I have a 40% deficit, on this side. And for rehabilitation, I mean, we're not talking about that in this presentation, but if I quantify a 40% deficit, then, when they're coming back, we can track that. And then I have something that can kind of set like an objective goal, for what they can work towards. So yeah, I'm a huge fan of the simplicity you know, of the app. And I could say, from a standpoint of using dynamometry for years, I also always have a non app based backup just in case, whether it's a $50 crane scale or something like that,
Mm-hmm.
because the technology is getting better and better over time. There's no doubt. But sometimes, batteries run out or my iPad runs out of batteries at the end of the day or something like that. And it's always helpful just to have a little bit of a backup too.
Sure.
So this is tension and compression based dynamometry, and crane scales are very valid and reliable. Like I said, I still use them as a backup, and I'll sometimes use them when I'm in the field or things like that, when I kind of need something to beat up pretty heavily. But it is a valid and reliable, affordable way to measure force. The digital tools obviously give you so much more, and rate of force development, something we're looking more and more at, with climbing athletes, and obviously the peak force and the comparison values and the way to track it over time digitally. But I want to do note that crane scales still are valid and reliable. And if someone's on a budget and they don't have the ability, to get a fancy tool at this stage, know that there is at least something that you can pick up. Eccentric testing is quite important as well. There's a lot of interesting research on this with baseball players, with pitchers, but the ability to test the strength of a muscle through a range and to do so eccentrically is something I've been experimenting more and more with these days. Because if you think about rock climbing, concentric strength isn't so important. Isometric strength is actually quite important, in the rotator cuff to stabilize. But really what you're doing when you're progressing up the rock wall and you're kind of moving your body over your arm as you're kind of eccentrically controlling this motion. And so that's a kind of helpful way to be able to assess as well with digital tools. And with this, normally I have the climber seated. I stabilize their elbow, making sure I don't pinch on the ulnar nerve too much. And then I just do one demo to have them get comfortable with the position. And then I'll press them down into internal rotation. This is testing eccentric force of the external rotators. There's some good research on eccentric strength and handheld dynamometry. And again, it's a valid and reliable method as long as you utilize it with the correct landmarks. I've gotten a little bit fancy with trying to find ways to make typical dynamometry more climbing specific. And so here's a unique way. Kinvent has the pneumatic dynamometer, which I'll show. Let me play this video. You'll see here is the pneumatic dynamometer. I have this little loom tool that I train finger strength with. And so I can test finger strength in this position, gripping on the pneumatic dynamometer. And then I could test finger strength in a different wrist position. And this can give me information of the influences of wrist kinematics on a climber's finger pain. And you can see here, I have this little tool that I use to train the fingers. And then I just slid the dynamometer. It actually fit perfect right into this spot. And it's a pressure gauge. And so I squeeze into that and it will give that exact kind of force readout. And again, checking in wrist extension versus a neutral or a flexed wrist. And, obviously you're going to have length tension changes of the fingers over time. But I like to use this, especially to determine if wrist extensor strengthening is needed for a climber with finger pain. And for example, if a climber grips in this position, they have pain, and they grip in this position, their pain is significantly decreased, with wrist extension. And then I go back to that dynamometer muscle test that I showed earlier in this presentation of wrist extension dynamometry, and there is a deficit on that side. Guess what their program is going to be? It's going to be wrist extensor strengthening to help reduce their finger symptoms. And so input from a lot of these tools is super valuable. There is no way I could get to that conclusion manually. I have to use digital tools to get there. In addition to manual muscle testing, also movement performance I've found is very useful. You can use the naked eye. You can use a variety of different apps. There's so many of them out there to analyze movement. But I like using a pressure sensor, especially for assessment, and then sometimes more so for training. And if we think about it, internal rotation is fairly common in rock climbing. We have to internally rotate to progress our body up the rock wall. And if a climber has shoulder instability, and I'll show an example here, they have a lax anterior capsule. If they go into internal rotation, and you'll see, watch his humerus, you'll see the humerus glides anterior. He's also getting some scapular anterior tipping. But you'll notice that this may be something that causes a climber anterior shoulder pain just going into internal rotation. And they report they have anterior shoulder pain when they're climbing or ascending up a rock wall. So normally, oh yeah, go for it.
Well, I was going to say one of the I think probably the most provocative sort of poll coming up, and maybe you can sort of tie it in. The poll basically is that there are enough digital tools in the market to make testing with the naked eye obsolete, and we have neutral to strongly agree as the responses, and I think that's probably the most sort of hardline statement so far that we've sort of made. And certainly you can argue both sides, I think.
Yeah, I mean, I went through a movement science fellowship, and just for context, I did my physical therapy degree. I did an additional year of an orthopedic residency. And then this movement science fellowship, day one, which is an additional year of mentorship and studies and courses and things, post-professional, Day one, they said, first 6 months, you cannot touch a patient. And what did I have to do for 6 months? Imagine as a physical therapist, not being able to touch a patient for 6 months. I had to use my eyes to pick up, to understand, to see nuances in movement. And for me, the eyes are actually the first thing that I use with a patient before I use any digital tools. And the hands are actually the first thing I use for muscle testing before I use any digital tools. But once I process the data, once I get an idea of an impairment, once I have a hypothesis, for me, that's when I start dialing it in. I say, oh no, let me video this, or let me dynamometer this. And I feel like the eyes and the manual components are so important, at least in my practice, as the screen. And then the digital tools then become the precision, if that makes sense. So yeah, I mean, if I were to answer that one, I think I would side, I think, with the group as well. But I'd say that I find so much added value by layering digital tools in my practice. That obviously that's why I'm giving this presentation.
Yeah, I mean, obsolete is just a strong word, right? Like,
yeah.
it's like, you have to have some direction, right? Because you can't process all of the data at once to try and make heads or tails of it. Your brain does that, and then you sort of, as you said, sort of fortify it further or prove or disprove it based on what the digital stuff tells you.
Yeah, 100%. And I think for climbing, we're kind of lucky that the movements are pretty slow and controlled. When you get to like baseball or pitching or anything that's like rapid, even soccer planning and cutting, I don't know if my eyes are that good. And so that's really when it's like, no, something that's happening at such a rapid speed, I kind of need, video analysis. But climbing, we can get away definitely, in my opinion, with naked eye assessment, at least for bouldering, which is climbing that's low to the ground, because you can see things quite well and things are quite controlled. All right, so we'll go back to this. You imagine you have that climber, they have that anterior shoulder pain, they go into humeral internal rotation, and they get some of that scapular anterior tip, but they get that humeral anterior glide, putting pressure on the front capsule, causing pain. So think about what you would do in this scenario. If you were to train a climber out of this, what would you do? Like, what would be your intervention? I mean, typically, maybe you would put your hand underneath their shoulder and say, oh, press down on it. Or you can have them take their hand and put it on the front of your shoulder and say, don't let it come up. But it's kind of hard to coach. They can't see their shoulder coming up and down. And so this is kind of where I find digital tools, especially this like pneumatic dynamometer is really helpful, because you can put that right under the shoulder and coach them to apply that posterior glide, that pressure into it. And you can either assess them, in this position and see whether it comes up, or you can train them and, put the iPad on their stomach, or have them look to the side on a TV set and have them train that posterior glide with internal rotation. And this is highly effective, because if they go into internal rotation and they feel their pain and they do it again, but they posterior glide their shoulder, push it back into the table, and their pain is gone, now you have what's called a symptom modification procedure. You have something that demonstrates the importance of this movement, and you can retrain the climber by using neuromuscular reeducation with some type of tool like this. Typically, this is a great in-clinic tool if a climber is coming to see you for multiple sessions. Kind of hard for them to purchase the device, get it on their own, and do it at home. But for in-clinic, I find this adds a lot of value. And we all love numbers, we all love competition, and to be able to press into that position and take stress off the front of the shoulder is a really nice value add for patients. So I think finally, also there's not just dynamometry, there's also range of motion tools. We have a goniometric protractor. We have smartphones where you can just kind of either draw angles on the smartphone or use it as an inclinometer. And then there's other external devices. And so here's an example of measuring external rotation utilizing a tool at the distal radius and ulna, where you can mechanically get the exact range of motion. And so I'll have the climber here. You can set the initial position and calibrate it. They'll stand still or stay still, and then they'll externally rotate, and they can externally rotate to that 90-degree position if you're testing that, and they can go all the way up into that position. You can make sure there's no compensations, and then you can get your value and compare it to the opposite side. And so this is a really nice way to, I find, like a post-operative patient, for example, let's say they had a Bankart tear, they're later on their rehab, you're trying to improve external rotation, range of motion. You're not so confident with your goniometric skills. You're taking the goniometer, you're saying, oh, you have 85 degrees. The next session, you're like, is that 85 or 86.2? And you don't really know. This is like a really nice way to choose one objective sign, track it over time. It's actually tracked in the app. Track it over time, and then have a reliable way to say, okay, this is how your range of motion is progressing. And I actually send this to surgeons all the time. It actually has a PDF printout, and it makes it super easy. It like tracks all the data points over time, so you can see how the shoulder range of motion is progressing. So that's just another way. So there's tons of different ways. These are just a few to utilize digital tools. You can utilize like makeshift low-cost digital tools, and you can then progress up to higher end tools, at different stages of your career, different stages, of your life as a clinician. And whether they are for manual muscle testing, with the digital tool, or whether they're for range of motion or even neuromuscular reeducation, I've found that they're a huge part of my practice and are really effective, at least for me, when assessing and treating rock climbers.
Awesome. Thank you so much, Jared. Super insightful, really awesome perspective on a very specific population, but definitely can translate to just, implementing objective measures throughout the profession and just in general, as you said, sort of progressively implementing some of these digital tools and objective measures throughout one's career, and starting as low tech as you can with the luggage gauge, and just having even, just reliability within your own practice before really considering higher level tools to add the validity to it. There's a question about the device. That's one of the Kinvent devices. It's the K-Move device, but it also sort of goes into the app. Thank you so much. Thanks everyone for being here. Super interesting topic and super insightful from Jared. And please join us next time for our next installment. Thanks so much. See you guys. Bye, Jared.